Okay, here we are back again with another guest on Dental TV, on social media, wherever you're watching, listening. Again, I was mentioning podcasts. If somebody's listening to what I will talk about with Agne, um, most people are listening to podcasts in their car because they're stuck in traffic. So if you're in the car and have the Dental TV app, feel free to listen to what we are talking about with Agne. And Agne, it's interesting. Before I give the word to you, it's Agne. I have to check the name. Agne Malisauskiene, or how do you spell it?
Yeah, Agne Malisauskiene.
Oh, but I know I googled what your name means.
What does it mean? Tell me.
Little girl.
No.
No, it's not true. I was like, if you translate it from Lithuanian to English, your last name, it
Uh-huh.
says little girl.
Malisauskiene? Yeah, I never thought about it. My first name, though, means fire
Agne
or
means fire. Wow, cool.
Ugne. Ugne is
Ugne,
fire. Ugne
Ugne,
is fire, but my name is Agne, so it's like a
Agne.
version of it. And Agne is also Agnus from the Bible, like sheep.
Yeah, 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 yeah. Ah,
So this is either or, but the last name, uh, it doesn't really have, but little girl maybe. Mali is like a small maybe,
yeah, but
and then the
just
rest
try
is the
just try it yourself. Put your name on Google and translate it from Lithuanian
okay,
to English, and the
okay.
translation is little girl. But okay, anyway. So
Do I
Agne,
look like one? I kind of
no,
do.
no, 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 no. Look, men always stay little boys
Yeah,
during their whole life, and women are not allowed to stay like
it's true.
little girls. So this is a difference, the difference between men and boys, men and girls. But anyway, maybe you can just introduce yourself to our audience
Okay.
for all those who don't know you. But I have realized that you are getting more and more famous. This is also something that is related. We will talk about that later. So first,
Okay.
Agne, who are you? Where are you from? And what is your passion in dentistry?
My name is Agne, and I am from Lithuania, Vilnius, Lithuania. It's a tiny country in the Baltic, by the Baltic Sea. And all I do is anterior composites. So this is what I do on Monday, Tuesdays, and Wednesdays. I see patients and I do my anterior composites. This is the thing I've done for the past 7 years. And then Thursdays, Fridays, or Saturdays are dedicated to dental education.
Wow. So, but basically, you are doing online education and hands-on. We talked about the importance. I say what you are teaching, and I browse a little bit what your courses are all about. Um, Basically, the most important part is the hands-on training.
Yeah. Well, the thing is, what I teach is generally, I call this everyday dentistry, but it's not sexy. So we call it still aesthetic something, whatever. But I have this tiny niche in dental education that I assume whenever somebody is teaching anterior composites, they teach composite veneers. And what I teach class threes, class fours, and something that you would do every day. So the patient comes in and you have so many things to do, right? You have posterior compost, you have crowns, onlays, wanlays, whatever thing, but you also have class threes, decays, tiny wear, something that you generally do every single day, not on a special occasion or a special patient or something like that. And I work a lot with ortho patients as well. So nowadays, aligners is a big, massive thing, and many of the treatments actually involve leaving spaces a little bit on the upper jaw, generally that is. And they have diastemas, they have traumas, and I'm the one closing that. And this is for me ended up being everyday dentistry. So something that was for somebody like very occasional thing, for me, it's an everyday thing that I love the most, probably these ortho patients and the space closures. I can do them really fast. And this is what I share with others, those easy and predictable techniques that, would make sense to do in everyday practice without any crazy planning.
Basically, you're not in a niche. You're covering the majority of what we are doing. So basically, it's
Yeah, but
always. I
nobody's
remember.
teaching that.
Yeah. But that's the interesting part. You're not going into a niche. You're helping dentists, but what they are doing and facing every day. I always tell people, if I look at the workshop by Nazari, by all Pascal Magne, by all these, they show full mouth rehabilitations with all the gadgets and the scanners
Mhm.
and the face scanners and the lasers and everything. And then you come home and you say, well, or you do a smile design, you do a digital smile
Mhm.
design course. And then you are waiting the rest of your life to
To find
find
that patient.
one patient that you could do this. But you find well, so many patients that you have to do the small things. I always
Yes.
say, I would suggest you can go into a niche. Your niche is front restoring front teeth. You can say, okay, my passion is doing implants. I try to focus on implant dentistry. You can also say, I want to focus on full mouth rehabilitation, but then you need to find your patients also. It's not,
Yeah.
I think I had an interesting interview with Nazari on this. It's, you can say, okay, I'm focusing or I'm switching from one tooth dentist to multiple teeth dentists, but then you have to do more than just saying, here I am, I'm now ready to prep 20 teeth. So
Mhm.
it's not that easy. And
You
a lot
have
of
to get
young, and
that trust of
yes,
the
you have to build
patient.
it up. Maybe sometimes the younger generation thinks, yeah, well, now I did this cool course with whoever, and tomorrow I will start making a lot of money and treating the big cases. I prefer your strategy because you're helping more dentists and the majority of dentists to perform what they do every day on a more consistent, in a more consistent way, in a more efficient way, increasing also the fun part, because otherwise
Yes.
it's like we today everybody's talking about stress, about
Mm.
all these things. For me, already a little bit too much. It's like overdoing. There was also some literature now. It's like trendy talking about
Oh, it
ah,
is.
I have, look, I suffered also from mental issues and blah, blah. Again, the main thing is if you have an intact family, if your social network is okay, I think you're not at risk of getting any mental issues. I know that
Yeah.
our profession is stressful, but
But all of them are stressful.
yes, yes. And for me, I don't see it in from the part. It's like my brother is doing software, so he can work from a boat, he can work from anywhere. I cannot work when I'm on holiday or when we are on vacation. No work, But then we are on vacation, and you cannot call a patient and charge for that. So, but it's a different approach, and we have chosen to do this way or do this path in our profession. And I think this is great. And I admire people like you focusing on like everyday problems and trying to solve them in a easy way, giving tips and tricks, sharing tips and tricks, sharing your knowledge. So this is important. I want to come back to one point that I started in the introduction. It's interesting if we are looking at the landscape of dental education. I see a lot of younger dentists. So for me, you belong to the younger generation. I just recently saw the poster of the Boston meeting, where I would say the average age of the speakers was over 60 years. And this is something, this is the old generation. In the past, it used to be like Quintessence, for example. They had a Boston meeting, a Yokohama meeting, a Moscow meeting, or whatever, had their local chairmen who had a network in their area, getting always 2,000 people in the room. Then Quintessence was inviting the speakers, telling, look, I pay you a business class flight. I don't pay you a honorarium. You get like a nice hotel, and you have the stage, and you can become famous. So the
Mm.
concept was on stage, if you perform well, then I would come and say, Agne, wow, this was such an amazing lecture. Can you come to Switzerland and do a lecture here, or even do a hands-on workshop? So this was
Yeah.
like the stage to present yourself. And this stage is has changed or has disappeared and has been replaced by the stage called social media or the internet. Nazari does not promote on. He promotes himself through the internet. You promote yourself through social media. A lot of other people around the globe are promoting themselves through social media, and you have to answer one question: why are most people that are doing so, or Maxim Belograd,
Mhm.
or a lot of people? Why is the majority of this young generation from Eastern Europe?
Oh, I think I think we've been so oppressed, so it's time to come up. I don't know. The thing is that dentistry here generally is extremely competitive. What I've seen traveling around Europe or the world, it's quite different what we do here. So if we think that, we have somebody that's really good at implants, trust me, we have like 10, 20 people that are as good. Because here, dental education, um, dentists would spend 30, 40% of their wage on dental education every month. They would not mind that. Why? Because after being in the socialist world, which I don't really remember, that's constantly reminded by our parents. Okay. So this is constantly being reminded to us. Oh, those times were completely different. What we're trying to build up is that Western capitalist world sort of a thing. And the competition is super high. So when competition is super high, everybody wants to be better, faster, and stronger than everybody they know. They don't mind sharing and saying, "Oh, I love this course and you should go on that course." But at the same time, they're thinking, "I'm going to come in with you and I'm going to do much better. And you're going to watch me do much better on that course," or something like that. So dentists here, they're extremely competitive. They learn all the time. They want to do better. What they want to do more. They want to earn more because generally dentists are not as rich in here. Like the base pay, whatever you make as a dentist, is not as high as you would get in Western Europe. Well, now it's changing. Now it's like the same almost, but in the past, like 2 years after COVID
Basically,
time, that changed.
it's raising in your countries as it's going down in our countries. You know that
Yeah.
that the average income of dentists has dropped dramatically. In some countries, it has dropped
Really?
dramatically. Yeah, yeah, yeah. Because we have better prevention, so we have less patients with big
That's
things.
good.
Yeah, no, that's good. But for example, I'm doing more composite than 20 years ago.
Oh, yeah, this is true as well. Mhm.
And this means, but if we look at the system, if I do, let's say, one CEREC, I have to do for the same amount of money, I have to do 3 composite fillings.
Yeah.
But if I do 3 composite fillings the way they should be done, it takes me longer than one CEREC.
Mhm.
So I earn less money. So I have to work more for the same money. So this is the
This
thing.
is true.
And I remember when I was a student, we had a professor, Mühlemann, who was one of the pioneers in preventive dentistry. And he was telling us what we started in the 1960s with prevention, with teaching the children how to brush their teeth, fluoridation, and so on and so on and so on. The communities paying the children the checkup every year that they go to the dentist. And he told us our vision is to make us disappear in a sense of that we need a small number of dentists treating the patients that have an accident, a few orthodontists, and that's it. So the number of dentists or one dentist can treat much more patients because the interventions are so small. But
Yeah.
the prevention works at a certain amount, but we are not getting really to the level that we would love to, and we see that also in medicine. That at the end, people are lazy. You can tell people you have to eat healthy, you have to do sport, you have to do this, you have to do that. You tell your patients you have to clean your teeth, and some people are coming. Yeah, I cleaned my teeth. They say, yeah, but I see that they're not clean. So this is the reality. But I totally agree that Eastern European countries, that there's you are more hungry
Mhm.
to be successful, and we are more in a situation where we think, yeah, we have everything, and we are good, and we are we are not so much willing to really move ourselves. And I see that the communities, the German, Swiss, Austrian, French, let's say many countries, the dental communities are, yeah, not really moving as they could. And maybe you're bringing new power. I like that. And if it's coming from these countries, nothing against that. And I really like that you're pushing. But I was just wondering why we have this large group uh, now from Eastern Europe invading the dental
Because of
community, teaching us, empowering us. Yeah, but you explained it the right way.
also, we don't have this sort of an insurance-based dentistry. So what we have in basically all of the Eastern Europe, so we have either public dentistry, which is very, very basic, and then we have the private dentistry. Nobody controls our prices, nobody controls the time, nobody controls what we do. So the competition is really among these private clinics and private dentistry. And there is this wish for even our patients to be healthier, to look better. And if you think about that, that in Switzerland, maybe longevity is a big thing. It's a massive here. It's like literally massive here. I just got pumped with NAD half an hour ago. So it's it's a thing, right? So and our patients are very demanding as well. They're extremely picky and very demanding. So this keeps us on our toes all the time. And I know I worked in UK for a year. I lived in Brighton, south of England. And when I moved there, somebody told me, well, the owner of the clinic said, well, Brits are picky, they complain a lot and stuff like that. And I saw this completely opposite because I thought they never complain compared to whatever we had in Lithuania, right? So then I come back and I see this whole different thing because our patients are very demanding, and this keeps us on our toes every single day.
But basically we need to be on our toes every day. But because
Yeah.
again, okay, you mentioned Switzerland. Switzerland is also, dentistry is something that is private,
Hmm.
and it was also a decision made in the 1970s when prevention was really taking off. And so our healthcare system decided not to include dentistry in the insurance in this healthcare system, because the dentists or the professors at that time um, highlighted, if you tell somebody how to take care of the teeth,
Hmm.
there's no need to treat them.
Yeah.
So we keeping this private pushes you also to take care of your mouth, because if something happens, you have to pay for the
Right.
damage yourself. And I think this strategy works pretty well in Switzerland, because if the system is paying for everything, you know what happens. The worst case scenario is then this NHS system in UK, or also in Germany. Now the healthcare system is paying only a part of the treatment. So patients have more and more to pay themselves for the treatment. But from my point of view, this is the way to go, that we have to give give also some responsibility to our patients, take care of their teeth and their mouth.
Yes, you said it, giving out responsibility for the patient. This is something really important. And this is what we generally, I guess, all of us educate our patients this way.
Yeah, we should. So coming back to your courses, so what is your main audience? Are you have in your courses? Do you have more young dentists? Do you have a mixed audience? Because I want to understand a little bit more who who is attending your workshops.
I would say 40 and younger. That would be the main group. I would get somebody way more experienced than I am quite often, except for the Americans, of course, because these guys are in a completely different system. So they kind of start learning something, what I call fun, which may not make them as much money. Only when the time comes, and the time usually comes when they're around, I don't know, 45, 50. So this is different for the Americans. For the Europeans, that would be 40 and younger. This is my main audience. I actually, before we started, I actually checked my Instagram stats because you can see the age. So that would be something around that. And that's the same for the courses. Um, in Eastern Europe, would say like Lithuania, Estonia, etc., like our part of the world, um, would be mostly female, only because that would be mostly female who would do any restorative work. Men would focus on surgery, implants, etc.
That's
What
interesting.
makes money is like, what makes money
Yeah,
generally.
but this is a good point because somebody was asking me, or I was starting a discussion. Why, when I was a student, we had uh, around 20% women, 80% men. The 2 years before the class, 2 years before me, there were only men, and now it's the opposite. And if somebody asks me, I'm saying there are two reasons. Reason number one: women at 18 know what they want. They are better
I
at
really
school
do.
than men, because a man at 18 is still a boy and
Yeah.
has different ideas. And the woman at 18 knows, okay, I need to be good at school to get a place to study dentistry, medicine, or whatever. And the second thing is what I mentioned, the drop in income, the selection of a profession, and you mentioned it perfectly. Men select the profession in relation to the potential income. When I was at 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 high school, gymnasium, we had one classmate who his father was jumbo jet captain at Swissair. He flew 4 times a month and he earned 20,000 a month in the 1970s.
Mhm.
So every boy wanted to become a pilot, jumbo
Pilot,
jet
of course.
pilot. Then in the 80s, everybody wanted to become a banker.
Yeah.
And then in the 90s, everybody wanted to become an IT specialist. Today, maybe everybody wants to become an influencer. I don't know, but it's reality that men select or look at what can I earn with this profession. And maybe this is genetically that we think we have to feed the family when we go to
Oh,
work. I
yeah.
don't know. Maybe it's that.
I think so. I think so. Then that's why in dentistry, then men choose something that's more profitable. You will not see them doing much of a, everyday restorative or preventive work or pediatric dentistry or something like that, which generally is not really considered to be well paid. Um, Also, for example, for me, so I graduated in 2013 in a class of 27 people and one man. So that would be 26 plus one. I think we graduated 25 plus one because one dropped out along the way. But this is tiny amount, I would say. And then in Lithuania, then we're now getting more men going into dentistry, which is very weird because before we didn't have anyone. It's like there was this cut after the independence that only women went into dentistry or medicine or something like that. And then it's changing, rotating, and whatever thing. But it's interesting how the landscape changes and everything changes. And as you mentioned before, it used to be even dental educators, right? You had to be a professor, minimum have a proper PhD to teach somebody. But what is changing right now, and I have the answer for that, is that generally PhD may not mean that you have your hand skills. You may not have the skill set because PhD is a scientific degree. This is science. Science is not something that you sometimes you may not implement it into your workflow and whatever you do at the practice. I guess this is really guiding that shift that, you want to learn something that you can implement the very next day. You don't want to learn something that you would know you know, this is nice. It's nice on paper. I saw so many scientists do that, but can I really trust and do this in my practice? Uh,
Yeah, it's like it's like the saying, if you need to do an operation on yourself, would you choose the professor, or would you choose his assistant who's really skilled with the hands? I would go for the and not so intelligent, maybe not so intelligent man or woman with skilled hands to do the operation rather than the
yeah.
professor who shows me all the titles and the badges and everything.
Mhm.
I totally agree with you. And this is also something that has changed and luckily has changed over years that people like not you, people like you, like many, many others who are not professors or not teachers at big universities are also sharing their knowledge, sharing their passion, sharing their skills, and train others to get better in our profession. And we saw with the Bologna reform 30 that started, I think, 30 years ago in Europe, because there was a discussion to downgrade dentistry, to remove dentistry from universities, because the reason was to save money. So the many countries in Europe were saying dentistry is just a cosmetic profession. They're
Mhm.
doing bleaching, veneers. It's like a nail artist. You know what I mean? So
Oh, that's what I'm always
yeah,
saying.
and then we don't need these expensive university places. We can downgrade that to another university level and save a lot of money. And they will do their cosmetic things anyway, and they are not doctors anymore. They're just tooth specialists or whatever. And then there was an opposition saying, no, 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 we want to stay at the university. And the result was that they increased the theoretical part in our education and reduced the practical part. And I saw that on the assistants that worked in my dental office coming from dental school. The quality of their manual skills was dropping down. It was good 30 years ago and it dropped down continuously. They are better in theoretical questions. If you ask them
Mhm.
what is the composition of a composite, or what are the ingredients in the anesthesia, they know everything, the chemistry and everything, but they don't know how to do it. So there's a lot of need of postgraduate training these days, because
Yes.
when you finish dental school, you're you're far away from, being able to be a
It's
dentist
true.
working by your own. So what are your thoughts on this?
This is true. For me, dental school was something that was really hard to get in. You had to be a top 1% or 2% of the class just to get into the dental school. It was very hard to study because we had to learn all the like anatomy, bones, nerves, muscles, and everything else of the full body because as you said, it's part of the university medical faculty. So you have to learn, as all doctors learn, for the first 3 years or so. Plus, you add on the teeth part. And then we moved on to the clinical part, which at my year, I think maybe a year before, it was reduced by a full year. So it
Wow.
used to be 5 years of education, meaning 3 years of basically theory, and then fourth, fifth year, you move into the clinical practice, you practice. And you used to have one extra year, which was supposed to be like an internship, full on practice in a polyclinic, basically like a public dental place. And then something happened, European Union, whatever thing, they wanted to match everything. And then they cut off the 6th year, and then they moved a part of it into the 5th year. So the last half year was a hands-on part, whatever thing. And now, what is now 12 years later, what we're seeing now, universities increase the size of a dentist that they accept the students. They increase the size. And now, as long as you pay, you're welcome to study dentistry anywhere in the world, basically. So as long as you pay this high fee, you have these free spots. For example, in Lithuania, I assume in all Europe, you have this free education if you're very good, but you can pay. And as long as you pay, you can be whoever you want and you can get into dentistry and then study dentistry. And now their clinical part is even more reduced, as well as theoretical part goes online. So this education type of changing. And that's why we have this massive increase of demand of postgraduate education, as you say, because once you graduate, you know nothing. Like it's so scary in that world. You come into the office and it's scary. And even the employers, they don't want to employ somebody who doesn't have any experience because they know how they come out. So now more and more dentists, after they graduate, they get the diploma saying that you're a doctor of dental medicine, whatever thing. They go on and they assist. They work as assistants. They help out. And in time, they're being built up as dentists, as like apprentice. Sort of we're coming back into the old times where everybody had like craftsmen would have their apprentice, right?
Yeah, yeah. We saw that in Switzerland, for example. When I studied, we had in the 4th and 5th year, every student had his own patients. And then after some years, there was like a lack of patients because there are too many dentists in Zurich. Zurich has more than 1,000 dentists for 400,000 people. So basically, we're
Yeah.
it's overfilled. And so there are no patients left for the university. And now the students have to share one patient. And I was like always saying, if you are the patient and you're treated by two students, you feel the difference if they are
Mhm.
different. You know what I mean?
Yes.
It
Yes.
might end up that the better of the two students will do more work than
Always.
the bad one because you know what I mean. They help each other,
Mhm.
and the patients will say, "Ah, Agne, maybe you do the filling because Alessandro." And I say, "Yeah, Agne, show me how you do it. I assist you, and I can learn from you." You know what I mean? So
Yeah.
the concept of sharing patients, economically wise, they had to do it, but for the education, it might not be the ideal situation. Or you need to find always a pair of students that are at the same level.
Mhm.
But this
But
is
that's
also
very hard.
difficult. It's also
That's very
difficult
hard because you never know.
because I remember that our assistants, our teacher at university were saying, you think we were 50 students. You all think that you are the same at the same level. So our feeling was that we are all as good as more or less. And they were saying the differences are way bigger than you think. So from the best student to other students, there was like a huge gap. And but when you're young, you don't realize that, and you don't think about all this. And but I think postgraduate education, but then it has to be done the right way. And I like your style that you're teaching the basic, don't get me wrong, the basic
Yeah.
things that we really need every day. When you finish dental school and you go to a workshop for full mouth reconstructions or a 1 week implant seminar. That's overkill. That makes you only more frustrated
Mhm.
than really helping you. So it's like these days we have a shortage of craftsmen, like
Mhm.
plumbers, electrician, like carpenters, whatever. And I tell my patients, if young people in my office, I say, don't go to university. I would become an electrician, a plumber, a carpenter, and maybe all the three in one, and you will have a great life because
This is true though.
because these people are like dying out. Nobody, everybody wants to be in the office and do a little bit on the computer, but the really hard work, nobody wants to do it anymore. And so this is a bright future if you are ready to work. And I think the same in dentistry. If you're ready to train yourself to become a better dentist, but start with the basics first. And that's why I really appreciate
Well,
people like you pushing or giving us the basic skills that we need. And if I see your work, honestly, wow, I like it very much. And it looks easy if I see what you're doing. But I know it's easy because you have the routine and you have found a good way. And it's great that you're sharing these tips and tricks with the younger generation.
well, yes, this is the thing, you know. I see these great artists per se, the dentists that are call themselves artists, and I see these beautiful composite veneers and really, really bad interproximals, extremely bad interproximals. That you know, this I I I can look at the picture and I say, your patient has a massive food trap, like insane. Probably hates you. The composite veneer is amazing, so nicely layered, everything else. What's the function of the tooth though? And how does the patient use the tooth? And these things are very overlooked. Everybody's trying to overcomplicate stuff. This is what I see: overcomplicate, make it too complex. New layering technique with 1,000 shades. And it's like the final result is just like an average opacity body shape kind of a look. So why?
Yeah,
This is a thing. We want to be very fancy in everything what we do, even though it's very difficult. It's, as you said, it's very frustrating for any dentist. My goal and my idea that you come to work and you enjoy yourself. That's the number one thing. If you hate your work, you're gonna be bad at it, no matter what you do. But if you love what you do, this is gonna be so much fun for you. You come into work and you're like, wow, this is so nice. I had a great day. I'm not tired, because you're not tired if you enjoy yourself. And I think this is very important.
I totally agree. This morning I did also I had two patients before our interview. Sometimes if I'm happy with the result, I'm telling my patients, the older I get, the better I get.
Yeah, this is true,
so, so no,
because
no,
you
no.
enjoy it as
I want
well.
to say my goal. I did since I started, I did 35,000 CEREC restorations, and I still try to make a better one. You know what I mean?
Yeah.
So because I'm never 100% satisfied with my work.
Oh,
Because
yes, because the moment you are
I say
satisfied,
if I can do a very nice preparation on a tooth outside the mouth on the model in the training. I remember when I did that when I was at dental school. They always loved my preparations, but trying to do the same in the patient mouth on the second upper molar distal, the
mm,
patient cannot open the mouth. And then somebody, I remember I did a course and I did a preparation and I scanned it. And then somebody say, yeah, but this preparation is not perfect. And I would say, can you please come? Can you please come and show me how
how to
you
do
would
it.
do it or how to do it? And because I love also to share my everyday dentistry. And it's interesting that if you are ready to share everyday dentistry, and I appreciate that you're saying this is getting more and more popular. We were talking about, let's say, the situation that working outside the mouth is not a problem, but working inside
Mhm.
the mouth can be challenging. But what I wanted to say with my statement that I enjoy my work still, and again, this is something I appreciate also seeing people like you that are positive, that are promoting dentistry, sharing their passion for what they are doing, and not following the trend of saying, yeah, basically dentistry is such a bad job, and I would never recommend my children to choose this profession. Basically, what we told our two sons are, one is working for Roche for pharma company, and the other one is a private chef, so cooking. So that's great. So that's
You.
that's 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 amazing. That's amazing. And both never thought about of becoming a dentist. So, but you don't force them, because in our family, I'm also the only dentist. So
Oh
when
yeah,
I
me
was
too.
18, I always wanted to become a journalist. So my passion was becoming a journalist. And it's interesting. That's why I also loved the 16 years I did as editor in chief of the International Journal of Aesthetic Dentistry, because this is my passion beside dentistry, is really writing articles, reading literature. That's why I started also on dental TV, my literature club. I have a collection of 9,000 articles that I read over the last 25 years. And I'm reading every day, because I think you should learn. So basically what you're saying, the PhD part, I think
Mhm.
it's still important, because if you talk about something, be, getting yourself ready on what the literature says is
Yeah.
also important, because
Oh yes.
we're talking about evidence-based dentistry. But
Yes.
I totally agree with you that in our profession, the knowledge, the literature is not that important as the practical part. It depends on what
Still
field of
half and half
science you are
probably.
in. But you need to know what you are working with, and get the facts behind. So basically,
Yeah.
literature is always something that stays important. And there, I found it a little bit frustrating that the dental community is not really reading that much. There are
Oh, they're
two
not.
factors. There are two factors. One thing is uh, you cannot access all the papers. That has
Mhm.
changed or started changing with open source. But still, it's like our oldest son telling me, look, oncologists should read really a lot of articles, because their field is changing very rapidly. So the in dentistry is different. You can have articles from the 1950s of Bonocore that if you put phosphoric acid on the enamel, you get this micro etching. So this is literature that is 60 years old that is still valid today. So
Yeah.
basically, a lot of old school, or you see like David Elleman promoting his 6 lesson approach with a lot of literature that is 20, 30, 40 years old. So he's the foundation of what he's doing, like biomimetic dentistry. The foundation is very old when we
Mhm.
when we look at the literature, because a lot of things did not change that much over the last years. But I'm always wondering why dentists are not reading more. What are your thoughts on this?
Well, because everybody is very visual learner right now. So reading articles is hard. Okay. So I'm done. I've submitted yesterday my first article. So I can tell you, reading is hard. We're very visual learners and everything else. So when you start reading articles, whenever you're reading, so that's probably a nighttime, right? You need to learn. First of all, we don't learn how to read. The act of reading is very important. It's not like if you scan through, read the conclusions, abstract, it's nothing, because you need to dive deep into methodology to understand what the articles is all about. And if you don't learn active reading, I went to high school for a year, an exchange year in the United States. It was a big private boarding school. And the first thing that they teach every single new student that comes in, this is the last 4 years of high school or gymnasium, right? So I came in as a junior, which is 11th grade. And I was going to a class with the ninth graders, 10th graders, and so on. And a lecture was called, or the class was called informational literacy. What they taught us is how to find information. I learned how to use proper databases, Medline, PubMed, actual in high school, how to find it, how to make prompts. So what you use now for ChatGPT, how to make prompts basically, and how to find things in the actual physical library, and how to do active reading with making proper notes, with nota bene things and stuff like that that nobody knows right now. Like nobody knows
I
what is
recorded
nota bene.
I recorded a series of videos exactly on these topics. On Dental
This is
TV,
amazing.
you find all
I
this.
downloaded Dental TV today.
No, because I started a part of that. So basically, the idea is to share things that you don't learn at university, and it
Yeah.
started with dental photography, one of my passions. Then it's video, then it's marketing, social media, well-being, and I also added last year the literature club, and
Here you
there
go. This is crucial.
and there I have really a large number of videos explaining how to do literature search, what are all the tools available, and I'm also doing reviews of articles. And I found an interesting way to I create like podcasts that are talking about the articles. So you can listen. So basically, I write a summary of the article, and then you can listen to a discussion. And this is really
This is
cool
how this is how to make things more interesting for Generation Z.
because then you
That,
can
you
then
know,
you can you read the title, you read the summary, and then you can listen to a discussion on the topic. And I
yeah.
think I tested that with some colleagues, and they say, "Wow, this is really cool because then I can listen to the article. And if I'm interested, I can read it, but I can read the summary. But the discussion really gets the most important points. What are the clinical implications? Should you ask more questions on this? So basically, this is the point. And sometimes, like recently, there was like a post by Markus Blatz on digital shade taking, and he was citing a study they did, and I was like commenting, well, this study looks a little bit biased, and it was, and he was like a little bit, yeah, not really amused on that. But I told him, look, I'm into digital shade taking for more than 20 years. I wrote the first book with Stephen Chu in 2003
Mm.
on that topic. And yeah, you have to be a little bit careful when doing research on certain things. But I also am aware that more and more literature is sponsored by industry. And it's
Yes.
the same thing that also our son told me. The level of evidence of scientific literature is dropping dramatically because, and also because of open source. Because in the good open source journals, you have to pay to publish an article.
Yes.
For example, I published one last year, a video article, and the fee would have been €3,000 for the author
Mm.
to pay. But they had an agreement with the Swiss government that the Swiss government is paying the 3,000 to the American publisher, that I was able to publish for free on the journal. So this is, and then it ends up that you're looking for sponsors to submit articles. The sponsor then tells you, Agne, okay, you have an interesting article on composite materials, and before you publish it, we want that you share the results with us. And then if the results are not in favor of the company, I tell you, Agne, don't publish this.
Hmm.
And a lot of literature, a lot of scientific work is not published because the sponsor says, I'm running out of money. We cannot finish your study because they saw that the results might be negative. So we have also to
Yeah.
be careful. And that's what you were mentioning. Don't just read the abstract and the conclusion. You need to go a little bit deeper into the articles. Or what today, it's interesting. There are more and more tools. I'm working with ReadCube papers, and they have now a functionality that with AI, you can ask questions to the paper.
Oh, okay.
And this is cool. So then you really ask, what is the statistic in this article? Okay, because I'm not so into statistics. And then it comes the result. Yeah, the C squares, the analysis is valid for this research or is not valid for this research. So you get a lot of information that you might not be familiar with just using AI tools also when you read literature. So these are the tools that are really enhancing, making it also more interesting to sit on a computer and browse literature and find out and play around as a new way to learn, to read more and learn more.
True.
Yeah.
And
So,
AI will help that. Maybe more will read articles when we have AI now helping us with everything now.
oh, you have to ask, we need to ask more questions. The problem is that we are getting the information and you don't ask questions. It's like when somebody was, one of my favorite topics is digital smile design. Digital smile design is a clever marketing strategy that is based on 100-year-old textbooks on full dentures.
Mhm.
The concept of digital smile design basically is a new interpretation of what the textbook on full denture says. So what is the most important part of a full denture? What
Smile
is the
lines.
most important step when doing a full denture?
I don't know. I don't do full dentures. Smile curvature and the midline.
No. Okay, you do the wax walls, so to
Yeah.
get the vertical
Yeah.
dimension. And then the first step of the manufacturing a full denture is the front teeth setup.
Yeah.
That's digital smile design. You select the form, you select the tooth form. So you have like a selection of
Mhm.
teeth. You say, okay, the patient face is oval, so or is round. So I need to take also teeth that are a little bit round. So select the form, you place them in the front. With the placing them, because you do that on the patient, you do that on the patient. So you do aesthetics by selecting the form and shade and color of the teeth. You do the vertical dimension, you do the phonetics, and you do the function.
The same thing.
And that's it. That's it. That's digital smile design. If you really want to learn the principles, the basics, you just go and read a textbook on full dentures, and then you understand what digital smile design is all about. And then the difference is that we use digital tools for that instead of just placing the teeth. And placing the teeth is what we now do, is the mock-up. The
Yep.
mock-up would be then the same thing, but with some downsides that most of the time we are over contouring the situation. It's not really looking how it finally will
It's going
look.
to be, yeah.
So it's, I compare it always. If you want a custom made dress, tailor made on your side, on your,
Yeah.
on, then you always do a try in. You never get it and put it on and it's perfect.
Yeah.
Even though they measured every details, they measured everything. And today, even digitally, they measure, but then you do the try in and you say, here it's a little bit tight and maybe the arms should be a little bit shorter or a little bit longer. And the same is with teeth. So at the end, the final thing is always in the patient mouth. That's why I'm a fan of chairside dentistry. I love to work on the patient as much as I can. And what you're doing is really chairside dentistry. You
It is.
work on the patient, you design, you create something new. It's not only about restoring teeth, it's also creating new things. And maybe as a final remark, you were talking about aesthetic dentistry. And do you know a specialist of unaesthetic dentistry?
No.
So aesthetic dentistry,
It's
dentistry
all
is all, dentistry today is about aesthetics. So for me, there's no specialist in aesthetic dentistry
true.
because there's no specialist in unaesthetic dentistry.
When the patient comes in and says, well, I have this decay, can you tell me if this gonna be an aesthetic composite or just a composite? So I ask them if their teeth should look like a tooth or be a blue something, like blue colored. And this is how we do it. You don't want your even molar to look like not a tooth. You don't want a molar looking like a flower. You want a molar with proper cusps, with a occlusal table and everything else.
Yeah,
So this is true. Every single thing that we do, we're trying to match that with something and, the mouth, the tooth. Because tooth for me, enamel is very aesthetic. So what I'm trying to do, I'm trying to find something, how to match that and to complement it instead of taking it away. So as you said, there's no aesthetic or non-aesthetic dentist. We're all dentists. That's the thing. We're craftsmen. That's what I always say. We're not artists. We don't create stuff. We copy stuff. We copy. We're craftsmen.
totally agree. If I'm always laughing when I see, also related to dental photography, the art of dental photography, the art of composite veneers, the art of implant dentistry. For me, sorry guys and boys and girls, there's no. It's you might be, I say, a lab technician for me can be an artist when he's playing around with optical effects. You can say, okay, when I do a stratification with 25 layers, you can feel like an artist, but at the end, it's copying something. And yeah, yeah. But this is another this is another thing. But I completely agree with you that we have to try to copy nature, but
Yeah.
it's not if because the definition of being an artist does his work only for himself. He doesn't care what others think about. If you're not like this, then you're like a portrait painter. A portrait painters. I'm a portrait painter, and you say I want a portrait of myself or my family, and then I have to draw everything that it looks as natural as possible. There's no art. There's no art behind that. You know what I mean? It's just
Mhm.
reproduction. I'm doing something like taking a picture, and if you're skilled, you can do it designing. Um, uh, but art per se is something that you only do. The artist works doesn't care about what other thinks, and we need to care about what our patient thinks. And this is
Yeah.
also when discussion are on stage. Sometimes people say, "Yeah, but look on the incisal part. I'm not seeing the mamelons. I'm not seeing this. You could have done this." And I tell people, "Look, I totally agree with you, and we can discuss about this, and I'm happy to get your feedback. But at the end, it's two people who decide about the work that you have seen on this picture. That's me and the patient that received the treatment. And everybody else, maybe you can say, okay, you go home and your husband says, well, but the tooth doesn't, I don't like the tooth that,
Yeah.
that, that Alessandro made on you." But basically, it's the patient and the dentist that are a team, and they decide also on the result and if everything is good or not. That's why I also hate this lists of top doctors and top dentists. This is so fake because the only person I wrote an editorial 10 years ago in the journal with the title "I am the best." Because there was like saying, yeah, after a conference, there was a speakers dinner, and everybody was starting like, yeah, I'm so cool, and I'm really the best in implant dentistry, and I'm the best in this, and I'm the best in this. And I was saying, no, nobody's the best. The best is selected by the patient.
Yeah.
And you might say to your patient, I know the best dentist in the world, named, I don't know, doctor whatever. And tomorrow he will come to my office and you can have a treatment from him or her. And your patient would say, no, no, Agne, I prefer being treated by you because you are the best dentist for me. Because
This is true.
you build it up trust. It's a relationship between you and your patient, and they trust you. And if they trust you, they don't want to be treated by anybody else. So that's why the best dentist does not exist. Or maybe I always say, maybe the best dentist is somewhere in Nepal in the mountains, and nobody knows this person because it's hidden and working in a small dental office, doing the best restorations you have ever seen, you can ever imagine, but he's not showing, and you don't see him, you don't see this person. So basically, these are the things. So thank you very much, Agne, for taking your time. And I will
Thank you.
I will follow you. And in the beginning, I was asking you when will you come to Switzerland? So if you have plans to visit Switzerland and or do something, I have also good connections in Switzerland. If you want to organize a workshop in Switzerland, yes,
Cool.
let's do that. So
All right.
I have some friends who are organizing workshops, and they would be happy to have like fresh blood. You know what I mean?
Yes.
Something
True.
different. And I'm sure that we could organize one or even more workshops with you also in Switzerland, because the Swiss dental community, I think, is also eager to learn more
I think so.
on composite, because composite for me is one of the most important materials that are around these days. It's easy to use if you know how to use it. It's economically, it's efficient. For me, it's really, yeah, my number one choice. If I would say, if I would have to say, what material couldn't you live without? So I would say I would stay on composite and forget the
Yeah.
rest, because I can do, let's say, 99% of my work just with composite.
Yeah. True.
And I hope to see you in Switzerland. And if you like have a final statement, okay, basically, if I'm asking you, what would you suggest to the younger generation? You belong to the younger generation, but what would be your message? What would you like to see more in dental community as your final thoughts?
My biggest um, and the best advice to any young dentist or younger generation would be to be consistent in what you do. Try to enjoy the work that you do. Don't overwork to crazy hours, 60 hours, 50 hours a week, because then you lose joy. And then you get tired of your patients as well. Um, and yeah, be consistent and see what you're doing. Analyze your work as well.
Cool.
That's the
Thank
best
you very
advice
much.
I can give you.
Yeah, that's nice. That's great. Okay. And thank you very much again. Thank you for
Thank
all out
you.
there who watched us, and stay tuned for more episodes on Dentistry TV and other social media, not only with Agne. Okay. Take care and happy Valentine.
Happy Valentine's Day.
Oh.